Boa noite, pessoal. Bem-vindos ao nosso webinar a respeito de estratégias para realizar uma boa prova do USMLE. Eu sou o Gustavo Busch, presidente da Associação dos Estudantes de Medicina de Santa Catarina. E gostaria de agradecer a presença de todos no nosso evento em parceria com a Brazilian Doctor Network. I'd also like to thank Dr. Judson Epperly for accepting our invitation for this webinar. Também gostaria de agradecer aos nossos parceiros, sem os quais a gente não conseguiria realizar esse evento, a Lactorio, o curso intensivo de ECG e também a Associação Catarinense de Medicina e a Liga Acadêmica de Cirurgia Geral e do Aparelho Digestivo da UFSC. A respeito do certificado, é preciso realizar a inscrição no link abaixo, que se encontra na descrição do vídeo. E também precisa preencher o credenciamento final que vamos disponibilizar também na descrição do vídeo. Bom, assim como os eventos anteriores, o nosso webinar de hoje vai ser dividido em 3 partes. Primeiro, duas partes. Vai ser uma apresentação inicial do Dr. Judson, em que ele falará a respeito das melhores estratégias para se fazer uma prova do USMLE, e ao final a gente vai ter um espaço para perguntas e respostas em que vocês poderão participar. E podem perguntar em português, o evento será em inglês, mas podem perguntar em português que a gente vai fazer a tradução. So, Dr. Judson is our guest for today's webinar. He attended the Louisiana State University. He has a PhD at the University of Phoenix, and he's currently the director at Littorio Medical. So, Dr. Judson, you can now start your presentation.
Obrigado, Gustavo, e também Kaique. É prazer falar com todos vocês hoje. Eu acho que vamos ter uma palestra que pode ajudar vocês muito em conseguir seus objetivos. Se vocês querem fazer uma residência nos Estados Unidos, vocês podem fazer. E é muito mais fácil quando vocês têm ajuda, por exemplo, esse Lactorio. So I'm going to go ahead and begin. So if you're wondering how I actually speak Portuguese, it's because my wife is Brazilian. Also, I got to spend some time in Brazil. And I really love Brazil. It's fantastic. Unfortunately now, given COVID, it makes it difficult to travel, but I'm hoping to be there next year. But if you guys have any questions at all, I'm here for you. So really, at any point, just go ahead and ask the questions that you've got, put them in the chat. And it'd be my pleasure to go ahead and answer them. So let's go ahead and begin. Let me go ahead and share my screen. Second. Oh, here we go. All right. All right, so it's called getting ahead of the curve, and I like to think getting ahead of the curve because ultimately you definitely need to be one step ahead, right? Because ultimately, sure, you're competing with others, but you are competing against yourself. It's sort of like almost like a combination of golf and some other sort of sport in terms of at the end you need to obviously get to the finish line. You need to win. You need to get that match. So the one aspect I can tell you is that having a system makes a world of difference, and I'll get into that in a little bit. But here you can see obviously me, and as well, I do want to point out that I've got 10 years of experience in international student recruitment, specifically around the USMLE. So pretty much there's not a question that I haven't seen and ultimately, or situations that I haven't actually really haven't seen either. And I can tell you in terms of experience and stuff like that, I'll definitely be able to give you some great tips. And I have some questions at the end. And if you have any additional questions at the end, feel free to do so. I do want to point out that we've got a series of webinars Lactorio does. And so we've got...
Sorry, I missed that. Could you say it again, please?
Guess Siri wants to speak to me. It's the weirdest thing. I don't know if it happens to you guys, but sometimes you're talking and Siri just comes on. It's the weirdest thing. So yeah, maybe Siri wants to be at my presentation too. I don't know. So I've got four events here. A couple of them are actually happened. We do have a new webinar coming up. It's called Master the USMLE. So I definitely would want to invite you to that as well. But I definitely appreciate having the time to talk with you guys today. So if you haven't heard of Littorio, and you know, for some of you, Littorio may be completely new. It's I can tell you, first of all, it's a German-based company. It's relatively new. It has a new mindset. I think in general, a lot of times students sort of wait till the last minute. And let me just stop there for a second, because ultimately I always like to make it interactive and engaging as much as possible. But I know we're on YouTube, so I don't know the limits. But what I would like to know is how many of you are actually still in med school? Can we find that out, Kayuki or Gustavo? Can they type in or not?
Yeah, some people can write in the chat, but I would say that most of our audience is still in medical school, because pretty much it's a partnership between the Brazilian Doctor Network and the Medical Student Association from Santa Catarina. So I would say like 95% of our audience.
What years do you think they're in? Specifically, where do you think where do you think most of them fall? Like maybe third year?
Yeah, well, yeah, it varies from like first year all the way to sixth year, so that depends. We don't actually have that specific data, but I'm sure a lot of people, especially considering the answers that we got from the registration form, or from the second year to the fourth year.
All right. So that's important to know. And basically, I want to make some changes to the presentation as we go along to sort of, I would say, personalize it to obviously your needs. I can say in general that what you need to do to honestly really be successful is you can't cram. You can't wait to the last minute to ultimately study. We know that you're not going to retain that information in the long term. So the best way to do that is obviously study with time. And that will allow you to go ahead and connect the dots. And ultimately, the more you can connect those dots, the more you're going to understand it and understand the big picture. Because I think it's very easy in medicine to go ahead and get very lost into small details, and many times not connect everything into one. Now, when we talk about all-in-one from day one, ultimately we're talking about all the tools that we have from the first day of med school. And that's real important, because ultimately, when you use Lactorio, it's not just to go ahead and ultimately become, let's say a physician in the United States. There's a number of actual benefits that you get. So you're going to become a better doctor. You're also going to have an opportunity to do medical residency in the United States. And as well, you become very familiar with medical terminology in various languages. And we actually have up to 13 languages that are translated in our program. Now, we are affordable, and previously, I worked for a company that was quite expensive in terms of providing preparation in terms of the USMLE. So I know that in terms of preparing, it can cost thousands of dollars, and when you're looking at Lactorio, it's quite affordable. And we sort of do things differently, and you're going to see that in terms of how we actually set up our system. So these are the faces of Lactorio, and ultimately they've won tons of teaching awards, dozens in fact, They do come from the world's best universities. If we added up all of their time, it'd be more than 200 years combined. They come from universities like Harvard, Johns Hopkins, UCL, and many other well-known institutions. The wonderful aspect about actually using Lactorio is that you're going to have access to them, and you're going to have access to this wonderful content that ultimately, many times in the United States, you'd be looking at paying hundreds of thousands of dollars, realistically. I don't know if you guys know, but the average debt of US physicians in the United States is somewhere between $200,000 to $300,000. It's a lot of money. Now, you convert that into reais, and that is even more money, unfortunately. Now, the good thing here is you don't have to pay that. You're paying actually for access to our platform, and you can get access to these doctors 24/7. And I would think really the coolest part is sometimes even if you don't have internet access, you can still access the many of the resources, and we'll get into that in a little bit. So how is it broken down? Well, when you look at our system, you got the preclinical, you got the clinical. The preclinical, you can see, is obviously tons of subjects. It's the basic sciences, right? And then when you look at the clinical, you're looking at obviously all the different areas, cardiology, etc. Now, I do want to also point out that you can actually filter by subject or by organ system. It just really depends. Sometimes some of you actually go to a university that uses an organ system platform, and obviously that would be more beneficial. And if you're more subject based, then you may want to do that. But the options are really up to you, and I'll get more into that actually when I demo the system for you, which is actually right now. So let's go ahead and take a look at the system. So I'm going to log on right now. I know y'all can see my screen. So here, we're actually in the student side. And right here, if I click on administration, now we're actually in the administration side. And some of you are like, okay, well, why am I actually showing you administration side? Because I'm going to show you that if y'all can help us maybe get into your university, we may be able to go ahead and get a program or a Lactorio as part of your program. And then you won't even have to pay for Lactorio. It would actually be included in your program. But let's go ahead and start with the student side. So on the student side, you see a bunch of tabs on the left-hand side. And just to make it simple, we're going to go from top to bottom. So we'll start off with home. And you can see there's a number of activities actually on the screen. So you can see, for example, study planner, video library, spaced repetition, recommended lectures, bookmarks. Now, here's the 40 and 99-day guide. I know a lot of you actually want to go ahead and do a medical residency in the United States. And so we actually have videos that cover that. We also have here, it's a study schedule, and it's quite in depth, in fact. And one of the biggest mistakes I can say is doctors not having a system, or, for example, changing the systems frequently. And so when you have something that's tested, that's actually proven, it makes a huge difference. And it's going to mean the matter of you obviously not losing a lot of time and getting the score that you want. So here you can see the study plan overview. And it's very obviously detailed in the sense of every day you're going to be covering a different area. And then if I keep going down, you can see obviously how it's broken down by areas. So this is the overview. And then if I keep going down, you're going to see how it's broken down into blocks. So you have block 1, block 2, and you would start from 6 a.m. Hopefully you can get up that early. I know that's pretty early. You may want to have your coffee, and definitely maybe even take a nap at noon. It's intense. It's basically like you're working a full-time job. You're just not getting paid for it, right? But that's the type of dedication you need to make. And this guy can make a world of difference. So that's the 40-day guide. I'll go back, I'll go into the 99-day guide, 1 second. So here we go. And you'll see a little bit about differences. Yeah, so that's old school, right? I mean, you got books, like, I mean, realistically, I mean, some people still do that, but, you know, with technology, there's no real reason to do that because your information can come to life. And so here, you can see obviously a breakdown. Keep going. And then you can see obviously the questions. Here's the blocks again. So another breakdown, obviously by weeks, by days, very detailed. And then of course you can click on that and you just go into it. So everything's laid out. You just actually, there are hyperlinks, you would follow it. Very easy to do. There's something else that's really cool. And it's basically, you've got these videos that actually break down the questions. So there's actually 30 questions, and that goes for the step 1 and the step 2. It'll literally break down cases for you, and it'll give you tips in terms of how to go ahead and resolve those cases, in terms of what to focus on, and obviously what are the pitfalls. So those are quite wonderful. And you would find all of that actually in this area. For the sake of time, I'm not going to do that right now, but I think you get the idea in terms of what can be covered. So here's the study planner. Ultimately, this is you in terms of doing QBank tests. As well, you can see performance on the videos. So here you can see anatomy videos. A lot of red, right? That means there's a lot of opportunity, but the green is good, it's progress. And then if you go down to the bottom, you've got the Lactorio tutorials. Now, I think this is probably one of the most exciting parts of the system, just because you can see just the content that's available. And ultimately, when I go a little bit deeper, you'll fully understand what I mean. So here, you can focus on different areas like pre-medical, preclinical, clinical. You can focus on step 1. Obviously, that's all the content you need related to step 1. Or you could go generic if you're not focusing on the USMLE. Most of you would probably obviously choose step 1. So let's go ahead and just click on step 1. But I do want to highlight that on the filter, you have different options. You can by subject, organ system, by disease. So you can actually see COVID, all the COVID resources. And I'll show that in a little bit to you guys. And then you can see the study schedules and guides, see everything that I had before. Everything is laid out easy. It's simple, almost like Apple-esque. So here's the anatomy, head and neck. Here we go into triangles. One of the coolest parts
to this presentation on
of this is you're going to notice that there is a 3D model. And so right here, this is it's a live lecture by the professor. He's actually from Des Moines, by the way, Iowa. And here's the 3D model. The 3D model is, I think, super neat because ultimately it's like almost like playing a video game. I can go in and out. I can fit, if I can choose different areas. It changes colors. It has names, and then as well, there's they're already laid out, so you don't have to do anything. You just got to basically rotate, zoom in, zoom out. Here's some more right here. And then I can keep going. The other cool aspect is I can actually write on it too, which is, I think, really neat if I wanted to do that. And I can actually download it. I can print it out. And so that's the 3D model. And we'll talk about that in a minute of why these models are important. So the bookmark is videos that I could see later. I don't really have time for them now. Let's go ahead and put the transcripts on. So let's say you're struggling a little bit with English, right? English, you know, you would like your English to be better. It's not where it's at right now, but that's okay, right? You're going to get there. But you can put the subtitles on. You can also put the transcripts on. And so now I'm going to play it, and notice that on the transcripts, it actually highlights in blue. So hold on.
Part 1. Here we have the introduction to the lecture, and two areas are highlighted, and these happen to be the triangles of the neck. So if you'll continue on this journey.
So you can see clearly it's easy to follow. It's in Portuguese. You can read it prior, you can read it after. It's up to you. You can follow it as it talks along. And then of course you have 13 languages. I don't know, I mean, I know you guys are in Brazil, but if you wanted to do, let's say, a clerkship in China, you could do that, or in Germany. You've got all of the languages here, so you could start learning the terminology. So eventually you could do a clerkship, you know, utilizing this platform. The other part is all the slides that the professors have, you can download yourself. I think that's huge because a lot of times you're like, oh, I'd love to have that slide. Well, you can download it. Notes here, very personalized, the system, because you can keep that, like, as long as you have it, and let's say you stop utilizing it, but you want to go ahead and start again, you could actually just sort of unfreeze your account and you could have access again. So that's our system. The cool thing is, if we go all the way out, this is really important. There's an intelligent algorithm in the system. And what that means is you got two questions to answer. What is the correct answer? And what is the level of confidence? And so here, I'm not that confident on it, but wow, what do you know? I got it right. So what's going to happen, it's going to change to memorized and due today. So let's go ahead and see a couple more questions. Here I got it wrong. And so let's go ahead and do one more. And I think now you guys got the picture, right? So it's going to ask you the most important questions to make sure that you're dominating them. And it has an intelligent algorithm. So it's going to keep following you and sort of tracking. So if you wanted to build into the system like an email every day, you could do that. And it would send you all of these questions that you could do. There's different ways to access them. So that's called a recall question. But when the recall questions, there's a number of them, you can see them actually in the spaced repetition. And basically the idea behind that is you're going to continue to see them until you master them. And so I can actually go in there and I could start doing them. The question bank, it's a QBank, right? And the only difference I would say in terms of the QBank is that obviously you need to test your knowledge. You need to make sure that you're getting it, right? Because you see the content, but you don't know if you're getting it. And this is the easiest way to do it. Here you can see by subject, you can see it by systems. I can see what questions I've used, unused, also correct, incorrect. So I know what areas are stronger and weaker. And then if I want to go ahead and create a test, I'll do that very quickly. So here I can actually leave an option for questions, for explanations, I mean. So I can see obviously why it's right, why it's wrong. I could actually make it exam-like if I put the clock on. This time I won't. I can make any type of combination of subjects and systems that I want. Here, just for the sake of time, I'll put 3 questions and I'll go ahead and start test. And one of the things you're first going to notice is this is very USMLE-like. It has the same colors, it has the same tools, lab values, notes, everything is very USMLE. It replicates it. Now you also see a clinical case. 27-year-old woman visits her family physician with a 1-week history of unpleasant fish-like vaginal odor, blah, blah, blah. Which of the following is most likely being seen in saline wet mount examination of the patient's vaginal discharge? So let's just go ahead and put C. Here we see a completely different type of question. Which statement is true about this patient's condition? So I put C again. In here, different type of question, 26-year-old woman, and then what is the single most appropriate recommendation? I'll go ahead and put B, change it. So here, at the end, I can go ahead and review and see how I've done. Now, what I can tell you is right here in that big rectangle is you're going to see the percentages of the students that answer the question before. So it gives you great context because now you know, okay, compared to the others, where you stand. But if we continue down, you can see obviously all the detailed explanations, but one of the coolest aspects is you can actually watch a video.
Let's talk about it.
And so now, instead of the information just sitting there, it's sort of coming alive, and it's going to help you obviously master it better. So you can also see book references, and if you see the next one, you can see as well more explanations, etc. I'm not going to go more into that. I think you guys got the picture. I do want to move on to something else that's important, performance. So here you can quickly see where you've been more active. It's been anatomy in this particular case. What's the best area? Microbiology. What's the weakest area? Behavioral health. But let's take a look at behavioral health. What's going wrong here? Well, sleeping disorders is a big problem. Specifically what? Stages of sleep. And now I can actually see the questions that I missed. How helpful is that? I'd say huge, because it's not just about knowing what area you actually got wrong. It's about correcting it. So now your weakness becomes a strength. And this system's going to help you do that. Now, down the road, let's say you're actually doing clinical encounters with patients. You can actually use this as a digital archive, and you can actually fill it out. And I think it's a wonderful tool because ultimately it's very detailed, asks for a lot of information. Here you can put the history, the physical exam, diagnosis, findings. There's 3 diagnoses that you could put down. Then you continue, procedure, keep going, and all the way down the end, notes. So imagine all the patient encounters that you have utilizing this. You could probably start seeing the gaps and the opportunities. COVID resources, we have amazing content there. Obviously, we know there's a pandemic. We also know people want access to a lot of information. One of the areas that I particularly like is the interactive case files. I think there's a lot of valuable information there. And ultimately, that can be very helpful for you in terms of obviously managing that. The other part I would like to say is the overview. You can see here, it's a breakdown, very detailed, a lot of major components, and you can see images, there's videos, etc. There's something else that I want to show you. Let me go ahead and go to bookmarks. These concept cards, to me, sort of blow my mind because when you think of what you need to do in terms of med school, right? A lot of times you're taking notes, you're trying to figure things out, sort of get big picture, yet make connections. These cards help you do that. So let's go ahead and take a look at the catabolism of amino acids. So here you can see the table of contents, obviously good overview. And then specifically, we can look into all of these areas. Now we're obviously seeing images, but we can click on these videos, and these videos help give you information, but it's all tied into the same sort of card. So you can understand, obviously, the connections and really take away what's needed. Very high yield, and I think very helpful. And so right now we have 100 of them, and the idea is we're going to have 1,000 of them. And I think at that point, that'll be a huge tool that you guys can leverage. So let's go back here. I do want to show you some simulations. I'm not sure if it's set up. So here we have a case, Adrian Moore. So what I do is I work with deans, directors, administration, and I talk to them about obviously opportunities to work with Littorio, having Littorio as part of the program.
Currently conscious and presents with audible breath sounds as well as tachypnea. History of stage 3 COPD and stage 2 congestive heart failure. Current medications include furosemide 10 milligrams twice a day, as well as bedanoside and formoterol combination, 1 inhalation twice a day.
So this is a clinical case. You obviously see the doorway information. And then ultimately what you're going to do is have an experience with this virtual patient, and you're going to have 20 minutes. In these 20 minutes, you're going to have options in terms of dialogue. You're going to have options in terms of physical exam as well. You can do, see the monitoring. You can also see medication, and then you can make calls. So there's a lot of different options that you can actually do. And a lot of doctors love this simulations, ultimately because one, some of them can't even go to the hospital. And the other ones, it's an amazing opportunity to get great experience before actually working on real patients. And I think it's helpful because as part of our system, you saw the videos, the quizzes, we have articles. So we have all of that that can be used as a base for these cases. And we have the cases broken down to where you get all of that prior to actually seeing the case. Waiting for this to come up, let's go ahead and go into the PowerPoint. We'll come back to this because it's taking a little bit to load. So, all right, here we go. So that was the demo. And now I'm going to go more into a couple of aspects. And so we talk about test taking.
Somewhat.
It's actually ready. Here we go. We'll go back to it. Took a little bit faster than I awesome. So here we go. So we have this virtual patient. And so there's a lot of options here. I can actually change the position of the patient. I can change the view here. You can see it's whatever I want. So we know this patient has a respiratory condition. He was at ER. He also is taking some medication to go ahead and deal with, obviously, his issues. And so thinking about that, we should probably have some differentials, right? And so we don't have too much time to ask all the questions, but we can focus on questions that actually make sense. So,
oh, Mary, come here.
We'll focus on all these questions.
What? At Mary's. What?
So we just asked all these questions, and now we're going to go ahead and do the physical exam. So on the physical exam, we'll go ahead and do airway. Take a quick look. There we go. It doesn't look too good, does it? Keep going. And so breathing. Let's go ahead and do a oops.
It hurts somewhat.
There we go. Pull up to Glasgow. Here we go. We got Glasgow now, that one. And we'll just leave that. So now let's go ahead and look at the monitor. I'm just going to put all of them just so you can see them. But there's all different types of options. So there we go. So let's go ahead and look at tests. What should be done? This one.
Test ordered.
So we'll do the sputum assessment. Now we'll go back. Let's see, another one. We'll do imaging. Let's do X-ray. Oops, no. All right, that. So I pulled a couple of tests. Now we make a call. Let's go ahead and call the pulmonologist.
Specialty was called.
And then now we'll do an intervention. Perfect.
It hurts somewhat.
All right. Intervention, here we go. Let's go ahead and change the patient position to 45. Keep going. Let's, in this case, do oxygen. We'll put the mask on. Let's do 28%.
1 minute. High flow mask in place.
Now for medication, I'm just going to go ahead and do antibiotics. So there's a number of things that I did right, and there's some things that maybe I probably should not have done. But the whole purpose behind this is I want to go ahead and show you at the end, in terms of the debriefing, what you ultimately would get. So it's going to ask you, first question, what is the most likely diagnosis? Any ideas? Let's go with that one. Looks like I got it right. So this was my score, 78%. Wasn't too bad. I did a number of things well. So physical examination did really well on the airway, the breathing, circulation, disability was an opportunity. You can see the first priority, second priority, obviously could have been an opportunity. Now, continuing on treatment, those were the areas that obviously could have done better. Medications, nothing, and then as well calls, same, and then interventions. So definitely opportunities there. If I look at the timeline, you can see everything that was done over the particular case. And then in terms of knowledge, you can see everything that obviously was needed. And that's the breakdown of the case. Now there is a option for Portuguese. So for example, we did it in English, but we could do it in Portuguese. Could also do it in many other languages. So the beautiful aspect is if we're able to get an agreement with your university, then ultimately this system, that could be part of actually your program. And so you could do virtual patient cases at your school, and you wouldn't be paying for it, it would be part of your program. So I just want to go ahead and throw that out there. So let's go ahead and continue on. When you look at the Lactorio content, this is the breakdown in terms of basic sciences and clinical sciences. You can see obviously there's more content available on the basic science, and that's just a reality of there's more information needed for the exam. Step one is obviously it's more intense than step two from a content perspective. So when you look at evidence-based medicine, that's really honestly what Littorio is all about. And so you're going to learn with us through the lectures, through the video lectures. Then you're going to apply, you're going to use the clinical cases, the exam questions. And then ultimately you're going to use spaced repetition to make sure that you're learning the concepts and you continue to dominate those concepts. Now, when we take a look at sort of test taking strategies, I would say number one, it's extremely important that you guys don't do the same activity over and over and over. You know, I have 10 years of experience, and I can tell you when doctors focus on just watching videos for 8 hours, that is a mistake. We're humans, we get bored. We want to be stimulated. We want that information to come to life. And if you're just doing it 8 hours, it's not going to be helpful. So you want to do different types of activities, which is called interleaving. We'll go a little bit more into that later. Linking abstract concepts to concrete examples. That's the beauty of the Lactorio system is you're going to see the live lecture, then you have 3D models at your fingertips, and you can ultimately play with those and start applying what you've learned with the models. And so you're sort of interconnecting, but you're definitely applying that information. Now, problem-based learning. Ultimately, when you work with the questions, that's going to give you a good opportunity to go ahead and find out why you got it wrong. And that's where you're going to use, obviously, additional resources, the articles, even books. We got a book matcher that's pretty cool that you can utilize. The book matcher is ultimately, you can take a photo or type in the page of the textbook. We've got 12 textbooks that you can actually look up. You type in the textbook page number, and the link of the video will appear. Now, assessing to boost retention and spaced learning, that is huge. Spaced repetition is critical. You've got to make sure you're dominating the concept. That is probably one of the biggest mistakes that you can make, is to continue down the path of thinking you've got the content, but you actually haven't. And it's actually scary it's concerning, and it's debilitating. When you've got to that point, you study 2 to 3 months, and you realize that actually you've sort of gone down this wrong path. And that's why I'll always say it's all about getting the right system in place and not changing systems, getting the right system in place. And at that point, then you can start really fine tuning it and getting to where you need to go. Now, in terms of Littorio, evidence-based learning strategies, the interleaving is critical. And that's where you're mixing the different activities to actually understand the content. And so you watch the videos, you take quizzes, and then you can focus on articles and books. And so you'll be doing them, I would say, like interleaving, mixing them up. And then problem-based learning, a lot of times when you start testing yourself to see if you're actually getting it, you're going to actually use the QBank. And at that point, you really want to take a look at why you're getting them wrong. And that's where the videos come into place to get additional information. But my personal take is I would be writing down, and I'd probably have some type of notebook, and I'd be breaking it down by subjects, and I'd write down, okay, I got this one question wrong in this area, and I would start seeing if there's overlaps in terms of common issues. Because what you're going to see a lot of times is one mistake appearing in a different area, and that's ultimately the biggest opportunities. Spaced learning. Spaced learning is really important because ultimately you need to know what are the important takeaways, the important areas that you've got to dominate. Because if you don't, then ultimately you can focus on content that ultimately is not going to make a difference, that you may not even be tested on. On learning medical concepts, we have those concept cards that I showed you earlier. The benefit here is that you got everything all in one. You got illustrations, 3D models, videos, texts, quizzes, all of that, that obviously can come to life, particularly the videos and the 3D models. It's not a matter of just reading something and hoping it's going to just sort of be absorbed. With these systems, you're going to actually have the opportunity to one, identify the areas of weaknesses, but really practice and have the tools to do that. So when we look at really, I would say, dominating these concepts or preparing for the USMLE, it all comes down to understanding the content. At the end of the day, you got to understand it. It's not memorized, it's understanding it. And that's why at the very beginning, when I said, stop cramming, start learning, learn over time, this is what the system does. It's going to allow you to understand the content, and then you can quiz yourself. And then obviously with the spaced retrieval, you're going to continue to dominate those areas. Now, something interesting is that a lot of times we work the QBank, we'll have this clinical case, and we'll see, obviously we get it wrong, but the reverse learning process is where obviously you see the mistake that you made, and now you're trying to fix it, right? And that's when I referenced earlier about having like a notebook and writing those mistakes down, trying to identify what are the areas where you're making them. But with the reverse learning, that can be extremely helpful. But that's more, I would say reverse learning is going to probably play a bigger role further down in your preparation process. Because at the very beginning, you're definitely going to need to get the content down before you apply it. Now, starting with Lactorio, obviously it's going to help boost you in terms of your scores, as well as going to give you more confidence. But I would say it's killing 3 birds with 1 stone. You're going to become a better medical student. As well, you can utilize our content and the translation features to go ahead and potentially even do a clerkship, some clinical experience in another country. Any of those that we have, those 12 languages that obviously are translated, subtitles and transcripts. And the other part is you can use it for obviously studying for the USMLE. Now, I told you, I've got 10 years of experience, actually 11 years now, of focusing on the USMLE. And I can tell you, in these years, we've had huge jumps. So right now you can see we're in 2020. It's hard to believe that, right? Like 2020. Wow. I remember when I was a kid, it was like Space Odyssey 2020. But we're here in 2020, and we can see that we've got a shortage of around 25,000 doctors. Now, some estimates and other, I would say, resources actually tie it to around 65,000 doctors. Just depends on the sources you're using. This one is more conservative. But let's play this out. 2030, we need 105,000 doctors, more or less, right? That's a lot of doctors. That is a real shortage. We need doctors like you all because we don't want to have an inferior system. There's enough doctors here to where we could get them, but it wouldn't be the same high level match. And that's why ultimately we want the best doctors. And if we got to bring them in, so be it, but we want the best. When we look at the workforce, 1 out of 4 doctors practicing in the United States are actually doctors like yourselves. That always blows my mind because I don't know any other country like the United States where it doesn't matter where you're from, but if you can actually do well on the USMLE exams and you've got some clinical experience, letters of recommendation, you got a real legitimate shot. And in some areas, you maybe not even need those letters of recommendations from US licensed physicians. Obviously, it's helpful and it's a differentiator, but we'll talk about that in a little bit. Now, in 2020, you can see the matches, right? So non-US IMGs, 2744. Non-US IMGs matched first-year positions up 2.5% from 2019. Significant. And what are the areas? Pretty much primary care, right? So you can see internal medicine, huge number, followed by family medicine, pediatrics, neurology, pathology, psychiatry. Now, what you're not seeing is ultimately the US IMGs. So United States citizens, IMGs. If you saw that, what you would actually be probably focused on right now is family medicine. Their family medicine number is actually 1,000. You guys don't want to do family medicine for the most part. You just don't. You'd rather do some other type of area, which I don't blame you, internal medicine, which leads obviously to a lot of subspecialties. But in terms of US IMGs, they tend to focus on those areas because they tend to be a little bit easier. So 2020 match statistics. Here you can see a breakdown by category. You can see US medical graduates, also known as allopathic seniors or osteopathic, sort of fancy terms to really actually say that they're just United States medical graduates. Now, you will notice that the match rate is not 100%. And the reason for that is, to my earlier point, we want the best and most qualified doctors. And that means bringing doctors like yourselves into the United States. Now, the 2 categories down below, US IMG, non-US IMG. Let me see if I have my passport. Hold on a second. So here's the passport I've got, right? This is really beat up, by the way. Look at that. I mean, you can't even see the eagle on there. That's how much I traveled on that. Anyhow, my point here is, if you have one of these, you would actually be considered a United States international medical graduate if you studied abroad. Now, if you don't have one of these, if you don't have it, you'd be considered a non-US IMG, non-US citizen, international medical graduate. Now, what's interesting is this person, the person who has this one, right? The US IMG, right? US citizen, right? US citizen, yeah. He or she actually, one, has less matches than you guys, and you actually have a higher match rate than that US citizen, right? Blows your mind. How is that possible? Why would you, who would have no connection to the United States, you don't have a US passport, you never studied medicine in the United States, why do you actually have more matches and a higher match rate? Because you're more competitive. That means you guys got better scores, you had a better, maybe letters of recommendations, but ultimately you were more competitive. And what you want to be in general, in terms of scores, is you want to be about at least 5 points above what the average is. And if you're above the average, you're very competitive. Now, if you're below, you still have a chance, but obviously it's not going to be as good as if you're above. You always want to be better than the US medical graduate. So money, right? So here you can see salaries, right? Exciting. You probably have smiles on your face. I hope so. Because if you want to do orthopedics, that's over $500,000. And if you're talking about converting that into reais, I mean, that's like 2.5 million reais. That's a lot of money. Now go down below pediatrics. It's like 225, right? So that's $20,000 per month. That's a lot of money. Now, basic salary of a person who's working, you know, at, let's say supermarket, Florida, because I used to live in Florida. I used to live like near Palm Beach, near Miami. They make around $7 an hour. So if like you do the numbers, and let's say it's $10 or whatever, it's around $1,200 a month. So $1,200, this doctor, the poorest doctor is getting paid $20,000. That's like an 18, 17 times difference of what that person's getting. It's a lot of money. My point here is that you will never be poor as a doctor in the United States. And really, for the most part, you will never almost be jobless. There's just amazing and endless opportunities, especially if you become a subspecialist, let's say gastro, cardio. And my point here is, if you look at, for example, internal medicine, which you can see internal medicine, you're getting paid around, why am I not seeing that? Oh, here it is, around 250, right? So around 250. But if you want to do cardio, you want to do gastro, you're looking at over $400,000. Big difference, right? So ultimately, the other difference is it's going to be a better chance for you to get maybe that visa, right? Because if you're a subspecialist, like there's even fewer of them. So they're going to be more willing to go ahead and find solutions for you. So just think about that. Now, what's the process for getting a residency? Well, you're going to start with ECFMG, Education Commission for Foreign Medical Graduate. Education Commission for Foreign Medical Graduate. Can you say that 5 times really quickly? No, I'm joking. You don't need to do that. Now, this certification is like a big deal, actually. And the reason it's a big deal is because, one, if you have it, you can actually do a residency in the United States. Woohoo. The other aspect is that if you're in other countries, let's say in Europe or Asia, that's a differentiator, because now you can actually make more money. They're going to pay you more money in general at top hospitals because of that. Now, most people probably don't want it because of that. They want it because they want their residency. So if you take the 3 exams, step 1, step 2 CK, and step 2 CS, all 3 exams, then you can get that certificate. Now, the question becomes, can you take all of these exams outside of the United States? Can you? And the answer is no, you can't. You can take step 1, you can take step 2, you can take step 3, but step 2 CS, that is the only exam you must take in the United States. You've got to take it in the United States. Why? Because you're talking about standardized patients. There's 12 of them that you got to go through, and they got to speak a very high level English. Very difficult to replicate outside of the United States. ERAS, Electronic Residency Application System. Electronic Residency Application System. That's basically for a JOB. I didn't want to say job like yeah, you got to get a job, right? And so the cool aspect about this is, yes, it is a job and you're going to get paid, which is exciting, right? Also means you need to work. Now, in order to get that job, you've got to actually be able to apply, right? You send out applications. That's the idea here, right? So how many applications do you need to send out? Around 100. Yeah. On average, you can send around 100. Now, let's talk about something here. For every 12 applications you send out, you should get 1 interview. For every 12 applications you send out, you should get 1 interview. That's sort of the unwritten rule. Now let's not take this to the extreme. You're not going to send out 300 applications to get that many interviews. Statistically, actually, what's interesting is the more applications you send out, the less probable it is of getting the residency, believe it or not. That is a true statistic. So what does that mean? It means if you're going to apply for residency, be strategic, do your homework, and take a look at photos. Let's say you want to go to Cook County Hospital. Look at photos. Do they sort of look similar to you? Look at names. That's a good indicator. If they've got someone who's called Joan, that's a good obviously clue that they're going to be hiring people maybe like you. And that's the type of thing you want to look at. Now, in terms of scores, there's some things that are changing. And I think in general, it's good, but it is a change. So step 1 last year, they thought that everybody shouldn't be sort of labeled or given opportunities just based on score. So they decided to go ahead and change step 1 to pass fail, meaning that step 1 is not the filter that it once used to be. So historically, these last 10 years, when you look at it, international medical graduates would need to score well on step 1 and step 2. And if they had some letters of recommendations from US licensed physicians, that's it. Now, so with the change of step 1 becoming pass fail in 2022, and I do want to point out something. It's not a guarantee that it will happen in 2022. Technically, the phrase that they said was no earlier than 2022. That would be the NBME. That's actually who I'm referring to, the National Board of Medical Examiners. So they said no earlier than 2022. However, the idea is that it probably will happen in 2022. What is the significance of that? It means that step 1 is not the filter anymore. Step 2 is, that'll be the #1 filter. And previously, step 1 and step 2, they were very similar almost in terms of importance. They were both filters. So now step 2 becomes the primary filter. Then step 3 actually becomes a filter. And then you have letters of recommendations. And then you have your CV, right? That's where ultimately maybe leadership, being part of a student org, stuff like that will actually make a difference. So my recommendation is ultimately try to get a score as high as you can on step 2. I would try to take step 1 as a student, so you can do maybe a rotation or a clerkship as a student, much cheaper, easier. You'll get 1 step ahead, become a smarter student by doing step 1. It's going to be pass fail anyhow. So I'd recommend taking step 1 earlier on, right after basic sciences. Replicate the same system that we use in the United States, that US medical students do. Now, NRMP, National Residency Match Program, that is the biggest match. Now, there's more matches out there, right? There's the San Francisco match, urology match, many other matches. But the biggest one is the NRMP. Now, we love, acronyms in the United States. What does OMG stand for? Oh my God, right? And TGIF is thank God it's Friday. Now, NRMP is National Residency Match Program. Now, just taking a break, because I've talked a lot, I just want to sort of like a factoid. Does anybody know what SCUBA stands for, right? Because we're talking about acronyms. Anybody know SCUBA, what it stands for? Because you would never, ever say that to someone. You would never say, it means it's self-contained underwater breathing apparatus. Self-contained underwater breathing apparatus. You would never say, hey, do you want to go self-contained underwater breathing apparatus this weekend? Yeah, you wouldn't say that, right? You'd be like, hey, do you want to scuba dive this weekend? And that's what you would say, right? So acronyms are actually important. And I would say that's one of the aspects that obviously, if you're coming to US, you're going to have to learn certain key phrases, acronyms, stuff like that. And my point is, the NRMP is the biggest match, and you will most likely call it the match. So Lactorio, we provide a foundation on on-demand video lectures. We have over 500 hours of videos, the highest quantity actually in the marketplace. We've got amazing test-taking strategies. We've got 30 cases, step-by-step walkthroughs on step 1, and we have another 30 on step 2 that break it down, that obviously become very valuable and helpful in terms of how to answer the questions. Because we know there's single jump, double jump, triple jump questions. Assessment test, we do have a diagnostic. So there are 4 blocks, 40 questions each, 160 questions. I would start there. And then based on that, I would start moving forward. We do have QBank, so you can see obviously step 1, step 2, and we have the study schedule. Now, recently, we actually just translated our QBank into Spanish. And our next goal is to go ahead and do that with Portuguese. That's what we want to do, which I think would be pretty cool. So then you could go in Portuguese or in English, and you could practice what you want. But that's going to be down the road. Student satisfaction, you can see that. I think it does make a difference when obviously you got a system that works. You got happy students, and you got students that are talking to other students. While Littorio, I think it's clear. We've got teaching award-winning educators, from renowned universities. You're going to stop cramming with us because we have the all-in-one solution. And of course, we do have high satisfaction rates, but I ultimately think it's the whole package ultimately. But affordability, I think, is important because one of the challenges that I saw when I was, 10 years just focusing on international student recruitment, and I was with a company that obviously was quite expensive, was that if you're a student and you're paying thousands of dollars, it's really difficult to go ahead and do that the whole career. So from day one all the way to the end, you're paying thousands of dollars. It's not affordable. And with us, it is. Here you can see a 2-year plan is basically like $200-something. I would do the 4-year plan, obviously, if you're further out, because you're looking at around $400, actually less than that. And then ultimately, you can always extend out if needed, if just the 2-year plan. But you can see the 2-year plan is obviously highlighted. I think 3 months is very short. And ultimately, you're going to get benefits, but the real benefit comes the longer you use it. The one thing I will say is I think a huge benefit of using our platform is sort of the flipped classroom approach, meaning before you go to the class, you can actually learn the material. You can start connecting the dots. So then when you go into class, you can actually ask more sophisticated, more developed questions. And I think that changes everything. Now, what I would encourage you to do is obviously try us out. You can try us out for a day. I'm hoping I can get you guys a link that you can try us out for 14 days. I'm gonna see what I can do about that. And I'll be in touch with Gustavo and Kaique around that. See if we can go ahead and send out a link to all of you so you can try us out longer. And if you can, I would encourage you to go ahead and obviously watch 30 minutes every day, and also to go ahead and do the diagnostic if you've actually finished out the basic sciences. In terms of time, let me see where we are in time. I don't know if you guys have any questions. I definitely have some questions if needed, but we should open it up.
I was actually talking to our team privately here. We did have a lot of questions throughout the week.
Sure.
Because we put up a form for people to subscribe for the certificate for this webinar, and we had a lot of questions. I think we're about 75 minutes with the live stream at this point. So what I would like to suggest, invite you, I would like to see your schedule, but we would like to invite you for another webinar. And the second one, we can just do a Q&A now that our students actually watched the presentation, which by the way was awesome. Thank you so much for sharing with us. That's definitely valuable information. So I'd like to check with you, is that okay if we could schedule a second webinar for do a more extensive Q&A?
Yeah, that would be wonderful. I I wish we had more time today so I could go ahead and answer those questions. It's amazing how fast time goes by, But I think it'd be an amazing opportunity to come back and obviously answer those questions. Perhaps what you can do, okay, I think it would be very helpful, is to go ahead and send me the questions that you have. And then on the next one, I can maybe throw in some slides, maybe on some key points.
Great.
And just focus basically on those questions. And then we just open it up and I'll answer any questions that come into the chat.
That's perfect though. So I'll email you the questions that we got from the audience, and I'd like to thank you so much for sharing this information with us. I'm sure I learned a lot, and I'm sure that a lot of people at home learned it too. Thank you for showing us all the features that Lactorio can help throughout the process for studying for the boards. And looking forward to see you soon again.
Awesome.
Thank you so much, Judson.
Hey, just one quick point, Kayeke. I do want to put, if you don't mind, if you just 30 seconds, I just want to put up my email just in case. Please. If anybody has any questions specifically that can't wait, or for example, let's say you have you want us to talk to your university in terms of maybe saying what the opportunity is to have Lactorio included in your program, feel free to reach out to me. This is my email. I'd be glad to go ahead and talk to your dean, program director. I think there's a lot of opportunities in terms of potentially working with universities in Brazil. I'm excited about that, but I'm also excited about helping you and answering your questions. So if you have any questions that just can't wait, please feel free to send them to me. But Kayeke, you and I can definitely talk, once we're done, and we'll go ahead and figure out a date. But I want to thank everybody. Y'all can do it, and we can help. The world is too small. No, it's too big for small dreams. Yeah, the world is too big for small dreams. You guys can do it. Sky's the limit. We'll help. God bless. Y'all have a great day.
That's amazing. Thank you so much, Judson. It's a pleasure to have you.
Thanks.
Take care. Have a great week. Bye-bye.
Thank you.
Thank you, Judson. Obrigado, pessoal, por terem assistido a palestra.